you're already up there.
Okay, and then just push
And
that.
then you just push that.
Okay. Hi, everybody. How are you? It's almost lunchtime. So I'm going to just slightly deviate a little bit in the sense that I'm going to be presenting something that's a little bit more about programmatic learning, less rigorous research probably than my colleagues. And also I'll be focusing a little bit in on exclusive breastfeeding as opposed to some of the other reproductive health issues that we've been talking about so far. We've been implementing a USAID-funded integrated food security program in the Khulna division of Bangladesh in partnership with another international nonprofit organization called ACDI VOCA. And in this program, we have several strategic objectives, but one of them relates to the health of pregnant and lactating women and children, particularly under 2. And so, as with most maternal and child health and nutrition programming, I've been doing this kind of work for 30 years. Most of it, as my colleagues have been saying, has been focused at the mother, right, at the woman. And yet the man in the household, maybe even other people in society have influence over that mother's decision-making and actions. And yet for some reason, we haven't really figured out how to engage, and I would say empower men or fathers to be active participants in those decisions and actions. So one of the things that we did in this program of many, was to undertake some formative research to understand what our behavior change strategies, messages, channels should be, right? So one of the formative research methodologies that we are starting to use more and more is something called doer, non-doer analysis, or sometimes called barrier analysis. And in this type of research, you really focus in on the differences between those that do something and those that don't. And then that tells you what those key factors are or determinants of behavior that you need to focus in on. So in the case of exclusive breastfeeding, you'll see family support indicates the largest difference between those that were exclusively breastfeeding, and those that don't. So that gave us a clue as to something that we needed to focus in on in terms of promoting, protecting, and supporting exclusive breastfeeding. So we unpacked that a little bit, and we decided that we would modify an approach that is being used in many programs called care groups, which usually clusters about 10 or so households together, and you identify a lead mother, and those lead mothers cluster, and then you have care groups. We said, okay, let's look at care group trios, where we're going to have lead fathers, lead mothers, and lead grandmothers. And those groups would meet separately, but then also come together from time to time and talk about issues that affect the family. So just focusing in on one, and again, this is a sort of a pre-post and therefore not as rigorous as we would like, and I'll talk about that a little bit, looking at exclusive breastfeeding behavior trends. And again, until we compare this to what it would have been in a control group, we can't say too much about it, but I can say that this increase in exclusive breastfeeding from the 31% to 56% is unusually large for the period of time that we were looking at, and unusually large for that particular part of the country and part of the world. So in terms of our experiences, we were really surprised, and in talking to some of these fathers, surprised at how much discovery was going on for them. I didn't realize that this is what the women were going through. I didn't realize this was important. I didn't realize when I was not involved in the raising of my first child, how important it was for me to do A, B, or C. So that sort of discovery was such an interesting thing, and a sense of pride as well. Pride in terms of, my children growing strong, supporting my wife, saving money, and being able to invest more in other things. So a lot of engagement, but beyond that, as I said, empowerment, I think. And I think that We definitely need to do impact evaluation or experimental design. We are going to be doing that in our new program that we're submitting for Malawi, a similar program in early April, and we have some resources already lined up to do that. So I'd be excited to share that at our next symposium. Thank you.